Your chest area extends from your neck to around your stomach, and there are many reasons you might have pain in that region. They can be serious or nothing to worry about at all. If you have chest pain, you need to go to the doctor. One reason you may have chest pain is from heartburn. Maybe you've had bronchitis or pneumonia, meaning that you've had an infection in your lungs. Perhaps you're under a lot of stress in your life and you're feeling anxious. There could be internal swelling near the heart, not the heart itself, but tissue near the heart could be swollen and cause chest pain. The area around your lungs could also be swollen and cause pain. There could be a blood clot in your lungs, which would be very dangerous. One of your lungs may have collapsed, which would make breathing very difficult. You may contract an illness called shingles. You might remember having chicken pox when you were a child, that itching disease with spots all over your body. Shingles the same illness as chicken pox. But now you don't feel itchy. Instead, you'll have pain in different parts of your body. You could also develop chest pain because you're having a heart attack, or you may have hurt yourself during exercise in other ways. You may be having chest pain from a car accident or from coughing very hard when you had a chest infection. Perhaps you had a bit too much to eat and got heartburn. You may have a family history of heart problems. And if you had chickenpox as a child, this pain may be shingles, meaning that the chickenpox virus has become active in you again. What do symptoms for chest pain feel like? Maybe you feel heartburn. You might feel pressure in your chest, or you might feel tightness in your chest. There could be a sharp pain, and that pain may not just stay in the chest area. It could move down your arm, your shoulder, back, or neck, or even spread down your body. The pain could continue for a long time, or it could come and go for different lengths of time. The doctor will examine you to figure out what the cause of your pain might be. The doctor will check you carefully, take your blood pressure to see if it's high or low. The doctor will listen to your heart to check the beat pattern. You may have a blood test, or you may need to get an EKG. That means that you'll have small electrodes attached to your body, which are wired to a machine that will provide a picture of your heartbeat, which will help the doctor see if there's a problem. You may be familiar with ultrasound technology because pregnant women have their babies checked. This ultrasound would be the area around your heart. The doctor may tell you to get an X-ray, which is another way to get a picture of your heart. The doctor will have various ways to help you. You may get medicine for heartburn, maybe Maalox, a white medicine that you drink, which you may have had before. If your pain is from tissue swelling around your heart or lungs, the doctor may give you Advil. If you have a clot on your lung, there are various medicines the doctor may try. If the doctor feels that you need help with keeping the heart unblocked, you may need to take aspirin. The doctor may decide you don't need any medicine at all and tell you to just go home and rest. You'll avoid exercise and activity. Just take it easy and rest. Once you go back home, what do you do now? If something you do causes chest pain, right away stop doing that and avoid doing it anymore. If you smoke cigarettes, use chewing tobacco, or vape, stop doing any and all of those. Stop drinking alcohol. If the doctor prescribes you medicine to take, follow the instructions carefully. If the doctor diagnoses you with heartburn as the cause of your chest pain, there are ways you can help yourself. When you lie in bed at night, don't lie flat. Instead, have your head elevated higher up. You need to eat right, avoiding fatty and greasy foods. You should try to manage your stress and anxiety. Basically, you need to take care of yourself. You should return to the ER if your pain comes back and becomes worse. If you have chest pain, and now you have a cough too. If you have chest pain, a cough, and when you spit up phlegm from your cough, you notice there's blood in it. In addition to your chest pain, now you have pain in your abdomen. If you feel weak, disoriented, and dizzy, as if you might pass out. If you feel like you aren't breathing right. If you become nauseated and start to vomit. If you feel that your heart isn't beating the right rhythm, either fluttering, too fast, or going too slow. If any of these things are happening, you should go back to the ER. You need to see your primary care physician, your PCP, if the pain lasts and won't go away, even after following all of the instructions the doctor gave you. If you notice pink, itchy spots on your skin in your chest area, if you develop a fever, you need to go to the doctor. If you suspect you're in an emergency situation, call 911. Don't wait until later. Don't drive yourself, even if you think you can do it. Call 911 and wait for an ambulance or ask a friend to take you.